Welcome to the First Nations Health Managers Association's weekly town hall, your resource for the latest COVID-19 related news and information. A town hall for us, by us. Over the next hour, you'll hear from health professionals and community leaders covering a range of health topics that impact Indigenous peoples across Turtle Island. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crow.
Tansei from the Mississaugas of the Credit, the Haudenosaunee, oh my gosh, I just had a lost thought. We're 1 minute into the show and I'm trying to do the land acknowledgement. So to everybody in the Toronto area, we are so humbled and so happy to be in your territory. It is with a bit of sadness that we come on this week and recognize the heartbreak that's happening and unfolding in Kisakus in Saskatchewan. Our prayers and our thoughts are with you as you bring your children home. So we are the First Nations Health Managers Association weekly town hall unpacking COVID-19. And let me tell you, we're going to transition the show a little bit in the next couple of series. And we are going to figure out unpacking how to get back 87,500 hours that Indigenous people live less than the rest of Canadians. So if you have some thoughts on how we close that gap in health inequities with respect to how long we live or don't live, 87,500 hours less, let us know. And if you have a question for any of our guests and you don't think of it during the show, you can always send it in anytime you wish. You can send that to FNHMA@ihtoday.ca. Well, I have to say I'm very excited for a couple of reasons today, and that is because of our guests. We have Dr. Evan Adams returning to the FNHMA Town Hall. Hi, Victor. Do you want to come on into the crow's nest, Dr. Adams?
Hello, Marion. So nice to be back here. Shall I report on what we've been talking about for the last couple of years?
Yeah, let's get started. What's new?
It's always a changing situation for us here in Indian country and dealing with this worldwide pandemic, and we just adjust to what's been occurring, and of course everyone is talking about Omicron and the fact that so many people are getting infected, affected. Lots of households, we've been talking about like households getting it because one person can get it in the household and then everyone has to stay home, but trying to stay apart and not have others get it. We're concerned about those of us in our household who are most at risk. So if you're young and strong, chances are, you can get through it with some mild symptoms, but there may be others in your household, like in my situation, and I bring them up all the time, my parents in their 80s, I will do everything to protect them. And I have a newborn grandnephew. And as you know, babies are not yet vaccinated. So little babies, unvaccinated. And so we're worried about little baby getting infected. So we're still being careful. So people are talking about, oh, this is getting mild, but we still have to protect those most at risk. And also with a mild illness, people are either staying home and not testing because it's like, well, there's Omicron next door, or, my friend over there has Omicron. So probably this mild illness I'm having now is Omicron. So I'll just stay home and not be tested. And people have access to rapid antigen tests. So we're starting to have a little falter in the accuracy of our confirmed positive tests of COVID. We just know it's that there is a lot, and I will tell you what I have from my view from here. As I've mentioned many times, we're much better at counting COVID cases amongst First Nations people in the provinces. In the territories, we're less able to count, particularly the Inuit. We're not great at tracking Métis cases, except in particular provinces and territories, and they gather that data themselves, so I won't be reporting on that. As of yesterday, we are aware of about 4,100 active cases. And again, that's the official count, and official testing is down. And that's a decrease in the number of active cases overnight by 313. So that might seem like quite a nice drop, but we've been hovering just over 4,000 active cases for a few weeks, and we were expecting that number to dip a little bit lower, because the rest of the country numbers do seem to be going down since the cresting of what we call the fifth wave, the Omicron wave, just a few weeks ago. And the number of affected communities has decreased again overnight from 288 First Nations communities in the provinces to 275. The cumulative number of communities ever affected since the pandemic began has been adjusted from 430 to 426. So 426 of us, of our communities, have ever been affected by COVID, and that doesn't mean that they haven't had one or two or three. Like in my community, we've had a few waves. We've also been counting what we call communities of concern, communities that have a number of COVID cases that are over 10. So communities that are overly affected, 10 plus active cases, has decreased from 127 communities to 118. So that's good news, and I have a little bit of a smile today about that. But we have had 4 new deaths overnight in First Nations people with COVID, and a new death amongst the Inuit reported in the media. So deaths are still occurring. That's a little bit of a somber feeling, and I think people saying, "Oh, it's just mild, let's not worry about it," is really like no plan at all, and maybe not a good way to function. And like I said, I'm still going to protect my parents. We're still going to be careful. I'm going to wear my mask around them. I'm going to socially distance from them, and I miss hugging my mom as much as anyone. But we are seeing some loosening of measures, public health measures across the country. Some jurisdictions, I think Saskatchewan led the way, said they were going to reduce some of the measures in businesses and some of the requirements around masking and around vaccine passports. Some people are saying that needs to end very, very soon. Really understandable. We're tired. All of us have COVID fatigue. We're tired of self-isolating. We're tired of not just the personal restrictions, but the restrictions that affect our work, our workplaces, our opportunity to make an income. We're seeing all over the news, of course, the truckers' demonstrations, and that has some understandable aspects to it, in that people are saying, are we going to change soon? But also some negative aspects to it, in that it's started to be about lots of other things that are, honestly quite irritating, especially for some of us as Indigenous people. So there is a lot going on. There are a lot of developments. The National Advisory Committee on Immunizations, for instance, made a couple of announcements, and one of them was around booster doses for teenagers that teenagers who had problems with their immunity, or what we call immunocompromised, who would have trouble reacting to a vaccination, maybe didn't have a really excellent response because of their reduced immunity, should be boosted. And that's very important for us to note. I know I have teenagers. I have a teenage son who was waiting to see if he would get boosted. And NACI also made an announcement about people who've been infected having that infection count as like a vaccine dose. That so, for instance, if I have 2 doses, I'm just about to get my 3rd, I get COVID, my immunity bumps up, but also I've just had COVID like days ago. Do I get my booster? And NACI has said, well, you've just had COVID. It's like a booster. Why don't you have your 3rd dose in a number of weeks? And that timing depends on a little bit on which category you're in, like what's your age group, and whether it's a 1st dose or a 2nd dose, that kind of idea. So lots for us to keep track of. Summer is coming. Spring is coming. Summer is coming. Spring break is coming. So yet another possibility of a wave. And I think we're all trying to figure out how much can we let down our guard. And our advice to everyone is what's happening locally, not what is the what's the premier saying in the capital city 500 kilometers away. What's happening close to home. Also, what are you comfortable with? No one should be forcing you to take your mask off or force you into meetings or situations where you feel endangered. You can say, I don't feel safe, and this is the measure that I'm comfortable with, and that is people's rights. And we want to remind people of that, even though I think for the last 22 months, all of us have felt exactly that way. So, for instance, if you were at work and there was, say, an outbreak, amongst your coworkers, we were advising employers, if your workplace hasn't closed down completely because of the COVID outbreak, and you have employees who are saying, I'm not quite comfortable today going back to work, we were telling employers, you should just take it easy and be sympathetic. It's understandable that this is happening. Also, it's understandable that people, will comply with the loosening of orders. We're just saying that people should be understanding of each other. Please be kind out there, and let's all keep getting along as situations change. Thanks so much.
Dr. Adams, so many good just life lessons in that. Can we get along? Can we be respectful? And can we be kind? Sounds like a good trigger on our cultural competencies of the 7 teachings, right? Everything we need to be guided by are in those teachings. Thank you so much, Dr. Adams. And you know the drill. Don't go away, because we are going to come back for Q&As with Dr. Adams. And before we go to our next guest, let's see Soar Above Stigma.
There's no such thing as an old addict. You either get clean or you die. I knew I needed to stop for my kids and my grandkids. There is hope, and there is people that do care and they do love you. I learned that our culture teaches something very powerful: compassion. Through acts of kindness and compassion, we find meaning in ourselves. I found connection. When we're connected, we're never alone.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, oh, like there's no point of like being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
I am so happy to be a part of those messages that were brought to you by Thunderbird Partnership Foundation, the First Peoples Wellness Circle, and of course us at the First Nations Health Managers Association. And don't worry, we'll play one more of those before the end of our hour today. So, you know, I'm going to do the reminder. If you have a question, an idea for an upcoming show on how to lessen that gap of inequities with our morbidity rates, you can email them to fnhma@ihtoday.ca. We certainly appreciate your participation. It's so nice to have a two-way dialogue where we can get your questions answered by credible, reliable, and relevant subject matter experts. All right, it is time to bring in a first time to the show, Melanie McKinnon. Come on into the crow's nest, Melanie. This, ladies and gentlemen, everyone watching on Facebook, everyone listening on all the Indigenous radio stations, if you don't know, this is one of Canada's top 100 most influential people in the healthcare system right now, Melanie McKinnon. Welcome to the FNHMA Town Hall. Melanie, I'm just gonna get you to unmute here. You know, it's that world we live in for the last 2 years. Mute and unmute. Those are my twin sisters.
Thank you. Thanks for that reminder. Yeah, it doesn't matter how long we've been doing this. It's still tricky sometimes it's the simple things in life that can be the most difficult, right? But it's a pleasure to be here today, and thank you for the invitation. So I'm originally from Grand Rapids, Manitoba. I'm espoused to Cree Nation on my mother's side, and my father's family is from Cross Lake, or the Majicamac Cree Nation. And I have the fortunate blessing of growing up in northern Manitoba and still consider myself a northern girl, although, you know, I do like the temperatures in southern Manitoba a little bit better. Although we've had a lot of snow and we continue to have storms here. So my background is nursing, and I'm proud to say that all of my career, 25 years this fall, I've actually celebrated my nursing graduation anniversary. You know, all of it has been in Indigenous health, starting off as a clinician working in several of our communities as an advanced practice nurse, and then later into management, as well as executive leadership in more recent years. So currently I'm the head of Ongwamazin, which is the Indigenous Institute of Health and Healing within the Rady Faculty of Health Sciences, the University of Manitoba. My other role, and what I want to talk to you about today, is our leadership in the Manitoba First Nation Pandemic Response and Coordination Team. And as one of the co-leads assigned to that role on behalf of the Assembly Manitoba Chiefs, with our colleagues like Dr. Marcia Anderson, Dr. Barry LaValle from MKO Kim, Ardell Cochran from the First Nation Social and Health and Social Secretariat of Manitoba, and of course, working quite closely with our partners in Southern Chiefs organization as well. And so part of our work a couple of years back, or almost a couple of years back, and understanding that this pandemic was coming quite close and approaching all of our communities, and trying to understand what we could do as First Nation health leaders, albeit in very distinct and different organizations, but understanding that we had very finite resources, expertise, and assets that were kind of spread throughout the province, but perhaps not one organization like our brothers and sisters in BC, for example, have with their First Nation Health Authority, of course, who we always look toward for their example and their expertise. Our situation in Manitoba was a little bit different, and knowing that we needed to draw upon all existing resources, cooperate and collaborate and come together in creating some kind of interim suspension bridge, if you will, between our federal and provincial government partners to ensure that our communities and our clients had access to all of the tools and technologies that they'd need to get through this pandemic. But not just from a health perspective, we wanted to build a bridge that was based on the teachings that you referenced, Marion, that many of us live by, that we wanted to take a population health approach and ensure that we're also supporting public safety, food security, other social and economic supports, community continuity. You know, what happens with respect to the health of our individual communities and our clients isn't just what happens in the health center and the nursing station. It's what happens within the community and, of course, the broader region and district overall, and what they have access to. So I just wanted to take this opportunity and participate today to really showcase Manitoba First Nation leadership. Certainly our political leaders and our chiefs and our council, our grand chiefs, for example, Manitoba kept COVID out of their communities, certainly in wave one, but gave us some time to plan, gave us a little bit of time to prepare and ensure that we had other, supports in place. It also gave us an opportunity to ensure that those partnerships with our federal and provincial governments were more streamlined, and that collectively and collaboratively, we as First Nation healthcare leaders and healthcare managers, and many of our colleagues are alumni of the association and our tribal councils and our communities. And it was this amazing opportunity of standing up and standing tall, uniting and blurring all community and organizational lines, if you will, to be able to come together and do this work together, because we knew that strength and those resources and our assets needed to be internal, as opposed to waiting for our partners to to do that work for us. And maybe some, concrete examples in particular around surge supports, supporting outbreak management and testing supports, and, the work through Indigenous Services Canada and the advocacy with the National Microbiology Lab, for example. We got point of care testing and rapid testing devices in First Nation communities throughout the province fairly quickly and in a phased-in approach. But again, that was through that joint advocacy. Our data management and information sharing agreements with our provincial governments allowed us to provide the evidence to our provincial and federal partners around access to certain tools and technologies. So being first in line for vaccines, as First Nation people, to be first in line for something that's good for once was our experience, and we certainly all collectively advocated hard for that. And it's currently the same in relation to therapeutics, whether it's infusions or IVs or oral medications. We want to ensure that there's equitable access, and that pathway to access is as low barrier as possible. So that advocacy continues to continue, but not just on reserve or in First Nation communities. Also, the supports for our urban Indigenous relatives was really important, and leaning on our health and social partners in our urban communities and our friendship centers. There's just this network that, again, our relatives in the cities really stood up and still stood tall to do things that may not have been in their regular work previously, but they certainly were able to do exemplary work in relation to running vaccine clinics and testing sites, so that those were really safe places for our people to go and continue to be in operation today. And thinking about all of those, wraparound services, which reminds me of the work in alternative isolation accommodations and how, again, our First Nation partners stood up to ensure that our relatives, our family members, our grandmas and grandpas and Cookham and Newsoms were having, a positive and healthy experience there, that they were still able to have, virtual ceremonial services or spiritual services or church services, that they were games for the kids, that there were medicines that were available. And so we took that approach with all that we've done. And again, as a larger collective, the leadership of Dr. Barry LaValle, for example, in harm reduction, and vaccine access to our precariously housed, family and relatives in our urban environments and in our northern environments, that needed that additional help and support. And I would be remiss to omit or forget our partners within the Assembly Manitoba Chiefs, specifically the ambassadors. The ambassador program, again, of hundreds of individuals that went into communities hundreds of times to support community continuity. When we get COVID, it's not just it's our family that are also responsible for community infrastructure or essential services. So what happens when public works go down? What happens when, the water truck drivers get ill and have to self-isolate, or your community supports or your grocery store staff? So we needed to ensure that community continuity and that those supports to backfill our members that may be home and ill and recuperating and recovering didn't have to worry about, those challenges. So I'm really, really proud of what Manitoba First Nations have been able to do. I think we've learned lots of lessons. What I would like to, end with is seeing this pandemic with all of its challenges and certainly all of the tragedies that have occurred from, our losses, but the opportunities that we have from a health systems perspective to do better and to be better and to, redesign and co-design with our federal and provincial partners for a health system that our people deserve, and is much, much overdue, as in this has been decades in the making. And as health leaders, we'll continue to push forward, and we will not lose this momentum of making healthcare services better for the communities that we all are responsible for serving. So thank you, Marianne.
Melanie, I can see why you're one of the most influential people in Canada right now, and I'm sorry to fangirl all over you, but I just really want to give you a heartfelt thank you. And speaking of thank yous, we do have a comment that I just want to read because it seems so appropriate right now. Isaac, thank you for your comment. I'm glad that you think this is awesome to be giving all of this information and knowledge, and also, I don't know why I can't speak today. I'm so sorry, viewers and listeners, but Isaac, thank you as well for giving the shout out to all frontline workers and leadership for making our community safe. And with that, let's go to a quick break.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
There's a harsh world out there telling us who to be, what to be, telling us that we don't deserve love and respect unless we're something we're not. After I got assaulted, after I went through the trauma, I went back home and I connected with my roots and I connected with my family. Their wisdom helped me a lot. My family, my kinship, they rejuvenate my soul. They remind me that I deserve love. Our culture teaches us something powerful: compassion.
Compassion does start with me, with us, with these dialogues. I am so, again, happy to show you that we do not have to live with stigma during this time. Be kind, be resilient, and keep being you. So, You know the drill again. If you have a question or a comment, not just for Mel or for Dr. Adams, but just in general, we'll be sure to bring it up, if not today, in a future town hall. We always make sure we send the guest questions after if we don't address them. So send them to FNHMA@ihtoday.ca. Another shout out. Okay, viewers and listeners, Dawson, Donna, Robin, Jarrett, Azad, Shirley, Jeanette, Crystal, Farah, Kathy, Sherry, and Vanessa. I see you. This reminds you of Romper Room. Let's not do that. We see you and we thank you for watching. So I'm going to go to the inbox now. I know we have an abundance of questions for our guests. And Dr. Adams, you might as well come on in, take yourself off on mute, and I'll get an appropriate question for you as I filter through these. So, Dr. Adams, I'm thinking we should address a couple of things. What do you say as a physician to the folks who think this is fear-mongering? Like, should we take them on a tour of the COVID wards? Probably not. Now, I'm being a bit sarcastic. What do you say to that mentality, Dr. Adams?
Yeah, it's definitely not evidence-based to say that this has been nothing. There have been millions of deaths worldwide as the U.S. approaches 1 million deaths. It's really hard to say that this was just someone made it up. I certainly understand that. I guess in some ways it's understandable. For some people, it is very hard to fathom the width and breadth of this. Also, I think for some of them, if they haven't seen it with their own eyes, perhaps it's less real. Like, oh, I can't believe that's actually happening on the ICU wards. I haven't seen it myself. Maybe some are colored by personal experience. Well, no one I know has had a severe case. I'm not sure. And then of course there are some people who believe quite a lot in conspiracies. So for instance, one of the factors in people being unvaccinated is their lack of trust in the government, in their provincial or federal governments. And as I've said, that is understandable. But I'm just remembering an elder that I met, one of my patients. He had rheumatoid arthritis, and you treat rheumatoid arthritis, which is an erosive arthritis. He had it in his hands, and he needed a pulse of steroids to stop that bout that he was going into. And it's a very kind of complicated to explain how the dosing changes over the days. And I was saying to him, do you want me to write this down so that you know just how much to take on which day? And he said, I'm not stupid. Why do you think I'm stupid? And I had to say to him, no, I don't think that. And I could understand he had been to residential school. Many doctors had been unkind to him, I think, or he just wasn't trusting. Understandable. My gosh, I just loved him to bits. But he still needed his medicine. I couldn't let him leave and say, oh yeah, I understand why you don't believe in us. But he needed to save his hands. So I think of that when I think of people saying, I don't trust you, I don't trust the government. And even my own cousins trust, the doctor on YouTube from Texas more than me. And I am puzzled by that. So I just, and again, we come back to our teachings, which is to be kind and to be respectful. I don't want to go over there and fight with my cousin. I don't want someone coming over here and yelling in my face. We have to live together, and we know that there will always be unvaccinated people amongst us, people who will choose not to be vaccinated. And one of the chiefs said to me recently, whether they're vaccinated or not, we have to look after them. So I definitely should not be crabby and fighting with people. being unhappy with them if they're choosing not to be vaccinated. And I have had to help look after, really just talking to some of my unvaccinated cousins and try and encourage them along when they get COVID, so that they feel safe and secure, and that someone's watching over them, me and maybe some others, to make sure that they they have the best possible outcome. So again, let's be kind, whether you're vaccinated or not, or no matter your beliefs. One day we'll look back on this and remember, oh, I was fighting with her and he was fighting with him, and let's just try that little extra and say, okay, let's have peace in myself as well as between us.
Thank you, Dr. Adams. And don't go anywhere, because I'm going to bring Mel back in after a couple more questions. So, Dr. Adams, I know you talked about this at the top of the hour, but let's really reiterate this point. So, if I'm coming up to the time where I'm eligible for my booster shot, should I do that now that we're seeing restrictions being lifted? Like, let's re-emphasize that message about whether or not we need to be boosted.
Yes, at the moment, the definition of being fully vaccinated is 2 doses. And we are thinking about, and maybe it's even happening in some provinces or territories now, really to be considered fully vaccinated, we should be thinking of 3. And that's because we do know there is waning immunity once you've had a vaccine, once you've had a dose. So for instance, at the moment, there are teenagers who've had their second dose a while ago. And so they're starting to come up as being eligible to be to get a booster and get their immunity boosted back up to a high level. And we know that being boosted, the 3rd dose, is the very best chance, gives you the very best chance against Omicron. Because even though the majority of people will have mild illness, we don't know who will have severe effects, and we must protect those of us who have the most to lose. And so it's not just about the individual; it's about protecting the whole of your family, or even the whole of your community. And it also means that if you can be boosted, then you can protect those you go to school with, or those you're at work with. So definitely getting boosted gives you the best chance possible. Not necessarily. Actually, it does prevent some infection. Most importantly, in fact, the most important thing is it's the best protection you have against hospitalization or death. We're actually not that concerned if you've had 2 or 3 doses and you get mild illness. In fact, that's what the vaccine's supposed to do. It's more that we don't want you to have an incomplete series and then get really, really sick. Like like my parents, it's possible for them to have reduced immunity, reduced reaction to the booster. Maybe time has passed, and if someone's careless around them, that's not great. But if they're boosted, they have the best chance of surviving if they actually get Omicron.
Okay, on that note though, what if somebody says to you, Dr. Adams, well, you're vaccinated, I'm not vaccinated. They won't be in a room with me, first of all, just saying, but aren't you carrying and able to pass on and transmit COVID as much as I am as an unvaccinated person? So why would I bother with that vaccine? So as a vaccinated person, do I carry and spread COVID as much as the person who's unvaccinated? What are your thoughts on some of those arguments that we're hearing?
Yeah, I am hearing some people who think that, well, whether you're vaccinated or not, you're able to transmit. So why would I get vaccinated? But that's not quite true. People who are unvaccinated transmit more and for longer. So people who are unvaccinated and get sick have a higher viral load. So they can spread more, and they're sicker longer, or they can spread the disease longer. So, if I'm next to an unvaccinated person and we're both sick, that unvaccinated person can potentially contaminate many, many more people because of what's happening inside them physically. They're just doing worse and putting out more than I am with my vaccination. So, yeah, some people are a little bit confused, and I hope I haven't confused anyone. For some of us, it's a little complicated to understand, but it is very important to remember that higher viral load and longer period of infectivity.
Thank you, Dr. Adams. I'm going to actually get you to mute, but don't go away. You know that, because we're going to bring you back in for some more questions. Melanie, come back, please. My new, I just fangirl all over you. This is the 4th time I've said it to you now, but Melanie, first of all, I want to say that there's a comment from Mr. James Bone, Certified First Nation Health Manager up in Kesey, who says, excellent job, Mel. So very Manitoba proud of the messaging that you're giving on the FNHMA Town Hall. Mel, it's been a rough 2 years, to say the least. You must have had so many moments, though, that have not only broke your heart, but touched your heart. When you reflect back on the last couple of years, share a moment that have just made you feel good to be a part of the Manitoba response team. Tell me about that, Mel.
For sure, Marian, that's a great opportunity to tell the truth, or the experiential truth of what it's been like to kind of co-lead and co-manage the response with my partners in First Nation Health. And so we were doing some work with respect to just projecting the hours, additional hours, if you will, of supports that these examples that I shared of resources provided to mainstream provincial and healthcare or federal healthcare systems. And it's upwards of 100,000 additional hours of either clinical services or social support hours of work in all of those different areas. So, a couple hundred individuals doing that work. And I think there's many examples that make me proud. But from my perspective within, the Rady Faculty of Health Sciences, which is a long-standing institution that is, built on colonial foundations, that we still have lots and lots of work to do with respect to anti-racism and equity and so forth. When our communities needed help with respect to surge support, so when we were looking for immunizers, and we knew that we are all competing for the same resources as far as the province and the federal government goes. When we put that call out to our faculty members, to our learners, to our staff that may have been eligible vaccinators, within 7 days, we had 350 individuals sign up to support and respond to our communities. And within 7 days, the university got beyond, their typical bureaucracies and their procedures and protocols, which are important to be able to fast track the recruitment and the onboarding process. So it told me, when we need to push, we can push. But when you open that door, there are more helpers that come and want to do this work with us, not just for us. So that was something that was pretty spectacular, that we aren't in this work by ourselves, but there are many, many pathways that we probably haven't fully explored yet from a systems perspective, is how do we want to, be reframed and rebuilt in this, recovery and post-pandemic era that we hopefully are approaching sooner rather than later. But on that note, I do want to just recognize, again, the commitment and the dedication for, our First Nation clinicians and our managers and our frontline workers who are part of those 100,000 hours plus, and have never left their community side. And I hope that our community members, can say thank you to their local nurses and docs and receptionists and lab techs, and their visiting specialists the next time that they see them, because they've never left your side. They've been right beside you and doing a lot of work behind the scenes that not a lot got to witness. But yeah, so my gratitude, and I raise my hand.
Mel, thank you for sharing that touching reflection, because we've got to remember it's all about our kinship behind all of this, making sure that our cookums are safe, making sure those communities are safe. And in all of this, from banging our pots and pans at 7:30 to now ripping masks off our frontline workers in Ottawa, I'm telling you, I have so much gratitude, so much love to everybody who wrapped their arms around our hearts and around the care of services we are receiving. And just another, really significant point, Mel, that you hit on earlier is we were first to be prioritized for a good thing. So I'm very happy about that. Thanks.
Marianne, can I just share one more? You reminded me on that point of something that was incredible. Speaking of vaccines, and it was just after New Year's Eve 2021, and the planes are flying, and I mean, I learned more about logistics and distribution, which is not my forte, in those few days of trying to get vaccines into community. But in one community that has an incredible uptake of well over 90%, I think the first vaccine was given within the first hour. We're like, is it thawed yet? So there was certainly an eagerness and great anticipation, of the vaccine as a helpful tool, and as a lifesaver for many of our community members. So that memory will never leave me. And I think it was just incredible that all of those hours, all of that effort to get vaccines out was well worth it when that first dose was given within the first hour from the plane landing.
That is such another good reflection. I think about some of those early pieces of work that was being developed all across Canada. And I also want to thank my team as well at the First Nations Health Managers Association for getting a pandemic planning tool out for our nations to use, as well as another tool to support our safety. Well, thank you, Mel. Don't go away. I'm going to bring back in Dr. Adams. So, Dr. Adams, here's another question for you. And I know that these are provincial discussions, but we've all been, briefly touching upon that restrictions are starting to lift. And with that, when we're changing, our minds about, is the mask still effective tool? It seems like it's easy and an effective intervention to maintain. Here's a question around that masking. Is it possible for one person in a household who has been cohabiting to not contract COVID? Or were they likely COVID positive but had no symptoms? Or another way to state that, if a person is totally exposed to COVID over a long period of time, is it impossible for them to not contract it? That's a long question. Where do you want to start?
First I want to say masks are effective. Masks are still effective, even if COVID measures are starting to change, and vaccines are effective, regardless of people's opinion. The evidence is just there. And yes, it is possible for only part of the household to get COVID, and the other part of the household to remain COVID negative and not get COVID by using public health measures. I've definitely seen it. And we were sending out advice to people in exactly those situations. Oh, someone's tested positive in my household. How do we protect others? And we were saying, well, for instance, whoever is sick should self-isolate. They should not come within 6 feet of anyone else, particularly those who are at risk. They should have their own bathroom. Just makes things easier. They should stay in their bedroom, and they should get assistance with things like meals or like homework or anything that they might need. And whoever's not sick in the household, whoever you decide can help look after that person. And whoever's most at risk, say grandma, doesn't interact with that person. Grandma never brings them meals. Grandma never cleans their bathroom. Grandma never goes and pokes their head in. Grandma stays away on the other side of the house. Now, that means, though, that you should have a large enough space that, the parties can stay apart from each other. It means having a second bathroom at least. So it could only happen in certain situations. What people have been describing, it's possible that the whole household is infected, and that one or two of them are asymptomatic. They appear well. That's possible. And we've also heard of one person gets it, the whole household gets it, and that's that was the nature of the beast, and not necessarily the fault of COVID measures. People saying COVID measures are not effective. That's not the case at all. So I hope that helps.
It does, Dr. Adams. Another person has written into the inbox, and feel free to just say, nah, not the question for me. People want to know when you are going to take a vacation. We've seen we know your exhaustion, plus we want to judge by your travel, whether it's safe for us to travel. So any plans for an international vacation anytime soon? What are you thinking about that?
I'm so glad this came up, and definitely I miss traveling, and I miss days off, and I miss having the time to make arrangements so I can see the people that I love, including my 6 kids, and I'm trying to find a way to stay at work, because we've been going full out for so long. Can we say to our workplace, could we take it easy for a short period? Like, for instance, imagine, I've never heard of this, but imagine if we said to our workplace, we've been going hard for 22 months. Can I go for a month at 80%? Something like that. Can we take unpaid leave as soon as it starts to quiet down a little bit? Because it is a little quieter now than it was. And I think it's really important for us to try and figure out how do healthcare workers, get to stay at work. We've just saved the world. Can you give us a little bit of a perk in some way, right? And for most of us, we were voluntary, right? None of us had. Well, not none of us. Most of us didn't have an increase in our pay, though our work days doubled in length. And I just wanted to quickly mention that the government of Canada did lighten border measures as a part of transition of the pandemic response. We understand that the world is opening up a little bit, and so what's happening at the border is going to change. So, for instance, this will affect people who are coming from other countries. Our conditions have slightly changed. For those who are going overseas, there can be changes to what kind of test is acceptable. And the government will no longer recommend that Canadians avoid travel for non-essential services. I think that will be like around February 28th or so. Those are really important, and that's just the latest breaking news. Those are really important moments for all of us, and I wonder what it means. Because for me, I've been trying to keep myself going by dreaming about going to Hawaii, knowing I can't possibly go to Hawaii. Just in my head, I'm in Hawaii. And what do I do now if it's more of a reality that I could actually go? And I wonder about everyone else as well. I think it'll be important for us to talk it out, right? Like, Marion, where do you want to go for your first trip? Melanie, where do you want to go for your first international trip? It's interesting. And how are you going to manage it? Because we're still going to bring our bikinis, but our masks, our matching masks at the same time.
I love that, Dr. Adams. Bikinis and a mask, and don't forget your flip-flops too. Dr. Adams, we have another minute left, and in this minute, I want to hear a little bit about something that's going on in BC. Are we having an election for the new CMA president-elect? And I think I saw your name. Tell me about this, Dr. Adams. Did I mute you, Dr. Adams? My apologies.
I muted myself.
There you go.
The Canadian Medical Association is having an election. Every year, a different province or territory gets to elect the new national president-elect, who then becomes the president and then becomes the immediate past president. It's 3 years. And it's BC's turn. So BC physicians will vote in the next national president. And a few of us, there are actually 6 of us, have announced our candidacy. The current president-elect, Alberta was the last province to go, has a First Nations national president-elect, Dr. Alika LaFontaine. So that's amazing. And so I have thrown my hat in the ring, and it's really important to me to try and help my profession, help other Canadian doctors to thrive. But also the job of the Canadian Medical Association is also to help the people of Canada and to help their health and well-being. And of course, I'm concerned about the health of Indigenous people, particularly because we have the worst health of any ethnic group in the country. Yeah, so I'm up for election, and elections will happen probably starting in about 2 weeks.
Well, thank you for putting in your name in that collective cap. And hey, BC physicians, let's keep the party rolling with another Indigenous president-elect at CMA. And with that, I say thank you. Stay safe until next time. Hi.